So what is a knee replacement?
A knee replacement is an artificial joint replacement whereby we trim the joint surfaces at the end of the thigh bone and the top of the shin bone and replace it with an artificial joint. It's usually composed of metal and a plastic in between.
So why might I need a knee replacement?
A knee replacement is usually needed for people who are in a lot of pain with their knee. And a good assessment is if it's interfering with your lifestyle or causing interference in your sleep in particular, and if simple painkillers aren't enough to control it, and your surgeon or your doctor recommends it, then it is something to be considered.
So if I was going to have one, what would I need to know before the surgery?
Well, you would need to know what the limitations would be after surgery and how long it would take for you to recover. It is a very, very successful joint replacement and a very successful operation in general. But it does take a good 6 weeks and quite often up to 6 months before one is delighted they've had a knee replacement.
So how long does the operation take and how long would I be in hospital for?
The operation takes somewhere between an hour to 2 hours maximum. And usually one is in hospital for up to 5 days. It can be a bit longer. Sometimes we get people out quicker, depends on how quickly they recover their range of movements in particular.
And what would I need to know after the operation?
Well, you'd need to know that it is a pain-relieving procedure. One expects some amount of pain after the operation, which is due to the operation itself. You'd also need to know that your leg can be quite swollen, and this is often because we use things to thin the blood out. But if you get an excruciating amount of pain or there's discharge from the wound that persists beyond the 5 days that one would expect a little bit of discharge, then that raises some alarm bells and it's probably worth consulting your doctors at that stage.